It's important to become familiar with the equipment that you may be using in IV therapy. We'll discuss angiocath, catheters, advantages and disadvantages of IV therapy. Angiocaths come in many different sizes and many different lengths. Some have wings on them, some do not. The color coding of the angiocath indicates the size of the catheter. For example, yellow is 24, blue is 22, pink is 20, then you have 18, 16, and 14. Catheters are available in a variety of sizes. The larger sizes may cause more trauma to the vein and increase the risk of phlebitis, or inflammation of the vein. The vein must be larger than the catheter size to allow blood flow through it. If you occlude the vein, then you've caused problems for the patient and potentially a thrombus or a blood clot. The size of the IV catheter that you choose is important. An 18 gauge, which is a green hub, is usually used in surgery in the emergency room. It's for patients that's going to receive blood transfusion, large amount of fluids. They also vary in length. The 20 gauge, the pink hub, is used for clients who's going to receive large amounts of IV fluid or thick fluids, or possibly blood, or for patients that are undergoing a diagnostic procedure such as receiving contrast before an X-ray. A 22 gauge or blue hub is used for adults with small veins or pediatric patients. It's also good for long-term therapy. A 24 gauge is usually used for pediatric patients or neonates, or also oncology patients, or for the very fragile elderly patient. They have a very small diameter, so the flow has to be low. Some advantages and disadvantages of IV therapy. The advantages include IV therapy facilitates prolonged infusions. They're easy to insert. There are less risk for infiltrations. And it also increases the client comfort. Some of the disadvantages are anytime you stick a person and leave something in the vein, you have a chance of phlebitis. The catheter must also be changed at least every 72 hours or per your policy. Wingtip devices, also called butterfly needles. They are stainless steel and leave a sharpened needle in the vein itself. So when the client moves, they're actually scraping the vein with that sharpened needle. These are numbered in odd gauges, 17, 18, 21, and 25. The sizes are very similar to an IV catheter. The wings are made of either rubber or plastic, mostly plastic today. They're good for single-dose therapy, for pediatrics, or for venipuncture to draw blood, if your facility allows such things. The lengths vary from 1/2 to 1 1/4 inches. And you can attach tubing lengths from 3 to 12 inches. Just add an extension set. When selecting a catheter, you must consider the vein size. The lumen, or the diameter of the vein, must be larger than the device you're going to use. The duration of therapy. A wingtip catheter is used for less than 12 hours. What kind of medications are you going to put in there? Or what type of fluids? A large bore, a 16 or 18, is used for large amounts of solution, or very thick solution, such as blood. A smaller gauge, a 22, can be used if the solution is hypertonic or highly irritating. This promotes dilution. So think of something that might have potassium in it. You're going to use a smaller gauge so that the blood that flows by that catheter can help dilute out that hypertonic or irritating solution. Some catheter guidelines for selection. A 14 to 16 gauge is used for multiple traumas, heart surgery, transplant. Again, 18 gauges are used for major trauma, surgery, or blood. A 20 gauge may be minor trauma, surgery, or blood problems. A 22 gauge for most clients, especially kids and older adults, is ideal. A 24 gauge is used for pediatrics, oncology patients, or the older patients with fragile veins. Prior to starting a procedure, you want to make sure you gather your equipment and make sure you have everything. You want to make sure you have your gloves, your IV start kit, inside of it, they vary according to manufacturer, but there should be a tourniquet, some alcohol swabs, some gauze pads, a cleaning solution of some type, a bio-occlusive dressing, and a site label. You also need your fluid, your catheter, your IV tubing, any kind of adapter such as extension sets or needleless adapter sites. You'll need an IV pole and some type of flow control device or an IV pump. You'll need to assemble the equipment. So you want to arrange the supplies in an easy, reachable manner. If you're right-handed, you want to keep most of the items on your right-hand side. Make sure you wash your hands. Position the client and assist the client to a comfortable position for you and the client's comfort. Introduce yourself. Teach the client and answer any questions they may have. Decide if you need to numb the area with either a cream or a spray, because anxiety causes vasoconstriction, which makes the blood vessels clamp down and it makes it more difficult to cannulate. Some special considerations: age considerations and developmental considerations. Do you need to numb the area? Is the client anxious about having this done? Do they have a history of maybe anxiety or depression, that type of stuff? Do they have developmental delays or disabilities of some type? You want to make sure that the client is able to express any kind of concerns or displeasure in an appropriate manner. One technique is to place a magic shield down. For example, clean the site, spray it with your Freezy spray, your numbing spray. Place a bio-occlusive dressing down on the site where you're going to stick. Explain to the patient you're going to put all the tape on there so they won't feel any tape pulling on them or sticking on them. And you can actually go ahead and stick through this device, this bio-occlusive dressing, and do all your taping on there. And that way, when it's discontinued, it makes it much, much easier for the client. So that way you're not pulling tape on and off, because sometimes that in itself will upset people. You can leave that bio-occlusive dressing on and it'll just wash off in the shower if appropriate. You can also allow a support person in the area and try to protect their privacy so they don't feel embarrassed.